It was noteworthy, Dr. Hashim, the previous speaker, included a number of components focusing on occupational health and safety. As an example in the U.S., this slide highlights the components and agencies that are participating in the U.S. National Biomass Program. Workforce creation is a component of both economic and social aspects, but the health and sustainability of that workforce is not explicitly identified. The major agencies that are responsible for occupational health in the United States, the National Institute for Occupational Safety and Health and the Occupational Safety and Health Administration, do not appear to be at the table. There are a number of serious accidents and fatalities that have been associated with biofuels production, both in the U.S. and abroad, reinforcing the importance of this issue. A systematic surveillance or evaluation of fatalities, injuries, and illnesses, however, has not been conducted. Biofuels production has matured to include a variety of different production systems, moving from feedstocks such as corn and municipal waste to now include cellulosic biomass and algae and other microcrops, although it is pretty apparent that corn and ethanol is kind of the big dog on the street right now in terms of what is actually viable. Much is known about hazards associated with the production of agriculture and forestry inputs and with the distribution and end use of biofuels products. And this knowledge can be applied proactively to manage risk in this industry. The risks of familiar hazards in new production situations and novel hazards, such as genetically modified organisms or the use of nanotechnology, have not been addressed well in this industry. Potential hazards that have been identified include biological, chemical, and physical hazards. Potential exposures can be quite variable, again, depending on specific technology, the stage of development, and the size of the operation. Engineered nanomaterial research has also rapidly developed over the last decade, and again, it's an area where potential occupational health risks with manufacturing and use of these materials is not characterized. Nanomaterials and nano-sized catalysts have been explored, especially in trans-esterification reactions for both biodiesel and bioethanol. The paucity of data on the adverse acute and chronic health effects from the use of engineered nanomaterials indicates a need for a full health risk assessment, as these products, again, are being used in biofuel production. The next slides quickly illustrate some examples of the types of occupational diseases known to be associated with exposure to organic materials, which have been used as biofuel feedstocks. The link between organic dust and respiratory disorders has been most fully explored, although there are also studies, jumping ahead a little bit, there are also studies documenting contact dermatitis, infectious diseases, and other problems. Our early studies in the 1990s of some of the first refuse-derived fuel processing plants to make the fuel actually found that gastrointestinal diseases was one of the most important problems for that particular workforce. Again, knowledge of these exposure-disease relationships and experience with developing effective controls can be used to help develop best practices and reduce the risk of disease in evolving biofuels industries. The following case studies provide a couple of specific examples of recent research. Sweden is the world's second largest producer of compressed wood pellets, which are being used as a replacement for fossil fuels. Hagstrom and his colleagues found that workers at pellet production plants were exposed to excessive concentrations of wood dust and rosin acids, indicating potential for a significant respiratory health risk. While they did not collect health data, this is an example where occupational exposure guidelines have been established for these particular exposures, and they can be used to develop control systems in biofuels industry. As part of a NIOSH initiative focusing on biofuels, this particular study of a biodiesel refinery focused on the alcohol methanol, which is most commonly used in the trans-esterification step to produce biofuels from agricultural feedstocks. In addition to the methanol itself, additional hazards of this process included the use of caustic chemicals for catalysts and a number of physical hazards. NIOSH, in this particular case, followed up with recommendations which focused on some very basic health and safety issues, including recommendations for properly storing and labeling bulk chemicals. One of the problems in this facility, they were storing incompatible acids, bases, and flammables together with no containment. One of the major recommendations that came out of this was implementing and adhering to process safety management or chemical safety management standards, which exist and are effective in other industries. And we'll come back to NIOSH a little bit later. This final case study from Denmark evaluated both exposure and health outcomes among workers at two types of biofuel plants and compared them to conventional heating and power plant workers. They did find that exposure to dusts, endotoxin, and fungi was higher at the biofuel plants, and they did find a exposure-response relationship for these exposures, which is consistent with the literature we have from agriculture and other industries. Again, the lessons that we've learned from other industries can be applied to anticipate and reduce some of these exposures. Just in the last couple of days, we were able to find two publications that I think were an important example of steps forward. Kralish has a publication in the Royal Society of Chemistry from 2012, and Al-Halwagi, if I'm pronouncing that correctly, has an article which will be coming out in the American Institute of Chemical Engineers. Both of these were focused on the development and evaluation of models to estimate a life cycle balance between productivity and worker health and economics. So they were two of the first that we saw that actually included a health component to the calculation of the potential impact, and were aimed at decision makers going forward in terms of designing facilities based on size of the operation. The inclusion of health outcomes primarily focused on fatalities, and the source of data they used to estimate that came from the chemical processing industry. But again, I think a very important step. The next few slides address agency activities and programs in the U.S. and abroad that specifically address occupational health and safety in biofuels. NIOSH does have an initiative addressing exposures, primarily chemical and physical exposures, as part of the NORA, the North American Research Agenda, within the manufacturing sector. Much of the current research related to this area focuses more on the end use of biodiesel, and in particular, there's a lot of work looking at the effects of biodiesel in underground mining. NIOSH, again, was also an important partner and sponsor for the Energy Summit workshop, which was held in Denver, Colorado in 2011, which addressed a broad range of renewable energy strategies. There has also been discussion about including biofuels as a more prominent part of the NORA activities, especially related to agriculture, forestry, and fishing sector. It is not clear, however, that NIOSH has been really engaged as a partner in the larger U.S. renewable energy initiatives, such as the Department of Energy and U.S. Department of Agriculture. OSHA has been active with the biofuels industry, both from a regulatory standpoint and from a consultation standpoint. The primary focus has been on high-profile and fatal incidents that are very typical of chemical processing and agricultural operations involved with grain handling and storage. Typical regulatory violations have included failure to use proper electrical equipment, deficiencies in hazard analysis and operating procedures, catastrophic chemical releases of energy, lockout, tagout, and confined spaces, respiratory protection programs. Again, some of the major issues that are really can be catastrophic and immediately fatal. A large proportion of biofuels businesses are small, and they're eligible for consultation services from OSHA. We have an example in the consultation program, which is part of my group at Colorado. We're doing some work with a small company, developing company, that is developing and implementing mobile biofuel energy systems that are being deployed around the globe. So they've got some real interesting issues to deal with, and it is a company that is kind of on the cutting edge in terms of development. And again, that's an issue that a lot of these operations are dealing with, is that they are pushing the boundaries. It would be beneficial for OSHA to utilize or think about a more systematic approach to the industry. Given the scale of research and development efforts in the U.S., there appears to be very little activity specifically on occupational health and safety beyond NIOSH and OSHA, although the number of efforts is beginning to pick up. Cooperative extension through the U.S. Department of Agriculture and the National Renewable Energy Laboratory have developed a number of practice guidelines which have been disseminated to the industry. In 2010, USDA initiated a call for proposals for development of biofuels related to their agriculture and food research initiative. And the big step forward with that proposal was that it did require a component dealing with occupational health and safety from the originating concept all the way up to the pilot scale implementation of those programs. I also wanted to point out a particular publication by one of our faculty in our high-cost ag center, Paul Gunderson, which focused on a discussion of potential future impacts specifically on agricultural producers and specifically from the standpoint of health impact assessment. One final publication, which is actually published by Biodiesel Basics, was a book for producers or the industry called Building a Successful Biodiesel Business. And this does include a chapter with a short overview of laboratory safety, workplace safety, what OSHA is, right to know. So again, a number of initiatives, but relative to the amount of research and growth of the industry, still a fairly small effort. There are a number of significant initiatives outside the U.S. that can help share lessons learned and offer opportunities for collaboration. The UK Health and Safety Executive in particular has developed a fairly robust program which includes research and outreach to industry. The World Health Organization and EU European Agency for Safety and Health at Work have tackled policy and equity associated with green jobs. The Swedish Stockholm Environment Institute evaluated potential sustainable developments for a wide array of bioenergy projects and specifically asked whether that project contributed to improving the health and safety of workers. Again, there are significant occupational health challenges in the rapidly growing biofuels industry, but there are lessons learned, particularly from agriculture and chemical process safety, that can be applied, especially to the major producers in the U.S. at this point in time. The occupational health and safety community, specifically including NIOSH and OSHA, should be engaged in U.S. programs, such as the U.S. Biomass Program. From a risk management standpoint, a systematic national industry approach needs to address worker health and safety as an integral component of production, quality, environment, and security. The NIOSH Agriculture, Forestry, Fishing, Health and Safety Centers and the NIOSH ERCs are an important national resource that has technical experience and some very practical connections to industry, and they can be tapped as a resource for this problem. Again, there are a number of significant initiatives outside of the U.S. that can share lessons learned. With some of the second generation and third generation developments, basic research is needed on emerging biomass hazards, again, including things like nanotechnology, genetically modified organisms, and other agents that are used in this rapidly evolving business. The basic research needs to be complemented by prospective cohort studies of workers in the field using monitoring of exposure levels and including long-term follow-up of workers. Systematic surveillance or evaluation of fatalities, injuries, and illnesses is essential to setting priorities and evaluating the success of prevention intervention efforts. Industry participation on identifying occupational health and safety risk priorities and on developing relevant, cost-effective solutions and best practices is essential for success. In conclusion, there are indeed significant occupational hazards associated with the biofuels industry, including recognized hazards in new environments and new hazards with novel agents. To make informed decisions concerning energy policy as a society, we do need to understand the true costs of energy production, including the cost of occupational risks. And again, a successful management strategy needs to systematically address worker health and safety as a component of production, quality, environment, and security. Thank you.